The School of Public Health at Indiana University is very unique. The faculty are caring. They don't just care about whether you do well in the classes, they care about you as a person.
Now I feel more connected to the School of Public Health on IU's campus, but also to all the schools of public health in the nation. I feel like I'm a part of a bigger team that's going about the health problem in America.
It's really exciting to be a part of the school at this time in its history. We really have a strong history of excellence, and I see us maintaining that into the future and actually expanding on it in a number of ways.
The School of Public Health, more so than a med school or a law school or a business school, is something that impacts every person on the planet nearly every day.
I really think that what brings us together, first of all, is rich history. Second of all, is our mission that is really committed for the disease prevention, health promotion, and enhancement of quality of life.
Founded as the School of Health, Physical Education, and Recreation in 1946, for many decades the school has been at the forefront of innovative approaches to health, community engagement, and quality of life.
Our school was established under the vision and leadership of Chancellor Wells. We became a premier school of health, physical education, and recreation. The school, as we describe it to our students, faculty, alums, it has been going through evolutionary process for 7 decades. When it was called the School of Health, Physical Education and Recreation, it was when we used to have a Department of Recreation, Department of Physical Education, Department of Health and Safety. Each of those departments, they have changed, they have progressed, they have gone through evolution process.
Today that evolution has led to an important milestone, the official renaming and process for accreditation of the School of Public Health at Indiana University Bloomington. A change that gestures to the institution's heralded past while also promising to carry on that proud tradition of excellence.
Honestly, I think it's a tremendous opportunity for the school. The name change will provide an opportunity for people to truly understand what the programming is about throughout the school. With HYPER being an acronym, you'd have to spell out all the different departments and areas that were encompassed in that. School of Public Health really speaks for itself. It truly defines what the school is about, our goals, our mission, and what drives us to continue what we're doing.
We were very lucky to have the great faculty that we had, and I think all of us are connected to those folks, and I think they would tell you, if they were doing this interview, that they're very proud of the school's heritage, but they know that moving forward, this is the right thing to do. This is a step that had to be taken to be relevant in the 21st century.
Well, it means a great deal to me and a lot of other people that it's now the IU School of Public Health. I think first and foremost, it allows the great state of Indiana and a great university, the Indiana University, to join other great institutions like the University of Michigan, University of Illinois, and having a full-fledged School of Public Health. Secondly, I think it more accurately reflects the true core mission of the school. All of the academic and professional programs in the school have to do at their base with health promotion and human development.
I think it means a couple things. One is that it shows an advancement of the school, of the program, of Indiana University. The other thing is, it doesn't make any difference at all. It doesn't matter what the name is, it doesn't matter what the logo is, it doesn't matter what the colors are. It's still Indiana University. Have my degree from there, and that's what I'm most proud of.
The name change also has important practical implications, opening a wide range of opportunities for teaching, research, and public outreach.
By becoming a School of Public Health, the university is going to be able to offer a diversity of new degree programs that heretofore they would not have been able to offer. They're going to be able to extend the kind of work that they're doing in the community to actually improve the health of the public. And they are also going to be able to expand their research portfolio in a way they couldn't even dream of.
I think it charts the future for the school. Bottom line is we need outstanding schools of public health like the Indiana University School of Public Health if we are to become the healthiest nation in the world, which we certainly are not now. The school will maintain its long-standing commitment to excellence. And in fact, being a School of Public Health will allow it to be more competitive for grants, and so I would anticipate that that level of excellence will even go higher.
Change is part of growth, part of development and part of the future. The speed of change is phenomenal. Our faculty, our alums, our students, and the president of universities, the provost, the leadership of this university, they have decided to make a historical change.
As we reimagine Indiana University for the 21st century, the School of Public Health IU-Bloomington, bolstered by epidemiology and other highly effective tools of public health, and by its outstanding faculty, students and staff, will help lead the way in cultivating a healthier citizenry in Indiana and across the nation.
Indiana University Bloomington is ideally situated to assemble such powerful research teams and to support them with unmatched technology to reduce the awful toll exacted by pressing public health problems. The School of Public Health will catalyze new collaborations that marshal the campus's strengths for the good of citizens in Indiana and across the globe.
Although the school has only recently officially become a school of public health, it has long been a leader in the field due largely to the school's unique scope and depth.
The Indiana University School of Public Health has many strengths, too many to count on one hand for sure, but I think the three greatest strengths is the quality of its faculty, the relevance and importance of its mission, and the opportunity it has to make a difference, to have a real impact.
The experience of a campus where the professors seem more than just someone that stood in front of the class and offered you their lecture and their experience. They became really, maybe it was because of graduate experience, but they became close. I think it's partly the Midwest, that people look each other in the eye. They seem to care about you. If you're in trouble, they're there to help. If you're having a good experience, they're there to celebrate with you.
It was like a comfort zone. You know, everything that I loved outside of school, recreation or just anything, you know, outdoors living and things that I enjoyed outside of school, I could come in to the School of Public Health and learn about those things and just kind of be a part of other people who shared the same interest.
While being here, I've had many excellent teachers. All of my professors have been my favorite professors. The best thing about them is that they're all genuinely interested in what they're teaching. They want to meet with you after class. They want to take extra time to explain things. They want to meet with you and talk about your career goals and help you in any way they can.
It's unique in the sense that the IU School of Public Health encompasses kinesiology and recreation and tourism and traditional public health as you would think about it, which really makes for more of a comprehensive view of what public health is, and I think that's something that a lot of schools don't offer, and we can really utilize that to transform how people think about public health and to really start tackling public health issues in a more comprehensive way.
The IU School of Public Health-Bloomington is also unique in having a robust and dynamic undergraduate program.
Us having a large undergraduate population really expands opportunities for our students to explore various areas of public health and to look at public health more holistically, rather than just looking at things like clean air or clean water or health behaviors. We're also looking at things like fitness, wellness, recreational spaces and how those impact public health. We also have students in sport marketing and management and sport communication that look at how sports enjoyment, either from a participant standpoint or from a spectator standpoint, really increases the quality of our life.
These undergraduates, if they decide to go to work market, they can make a difference in terms of public health of our communities. But also these students are the future graduate students for our programs. And these students are the ones who would be better prepared to pursue master and doctorate degree than students who don't have any public health backgrounds.
The world today is faced with a growing number of serious health issues, including obesity, diabetes, and the scourge of HIV/AIDS, to name only a few. The IU School of Public Health-Bloomington is now better equipped than ever to address these challenges.
One word: technology. Indiana University School of Public Health can really work hard on the issue of public health informatics, medical informatics. Those kinds of strategies improve public health decision making.
We know from the work of the United Nations and the World Health Organization that non-communicable diseases will be the #1 health, disease, and disability threat to the world and to the United States in this new century. Uniquely, the Indiana University School of Public Health has programs to deal with all of those: heart disease, cancer, lung disease, and diabetes.
The School of Public Health-Bloomington is also well positioned to train and produce students to become leaders in the field.
The School of Public Health is beginning to work on how it can be a partner and prepare the future alums of the school to be participants in the healthcare challenges that we face as a country. I hope that this message reaches people who have not thought about Parks and Recreation as a profession, and the light bulb goes off over their head and they go, I never thought about that. Maybe I'll pursue a degree from the School of Public Health in Parks and Recreation, because that's a part of the big picture of public health.
I had no background in public health before I came. I was focused entirely on nutrition, so I had more of the technical, nutritional aspect. The School of Public Health really gave me the skills to develop programs, to implement programs, to work with stakeholders from a variety of aspects, especially those that are not traditionally associated with public health, such as schools and these major corporations.
Job opportunities in the area of public health and wellness are really expanding as individuals become more and more interested in leading healthy lifestyles. So that means there are lots of job opportunities available for our students. Our students can work in a variety of different settings, everything from fitness centers to community centers, hospitals, clinics, school systems, park and recreation settings, government agencies.
Drawing on its rich past while embarking on a new era of excellence in teaching, research, and outreach, the IU School of Public Health-Bloomington is proud to be able to make a difference in people's lives.
Our message is very simple. We treasure the past. We are proud of our past. But we have decided to embrace the future with a broader mission: preventing disease, promoting health, and improving quality of life for our citizens. That also contributes to economic development and health care cost containment.
I think that both physical and mental health are essential, and I feel blessed to know that I'm going to take this education and use it every day for my individual, relational, and career life. The students that have graduated from the IU School of Public Health are going to be out in their careers very successful and helping to increase overall health in adults and children in America.
Well, the Indiana University School of Public Health is worth investing in because of the fact that it can have such a tremendous impact in shaping the future of this nation, making sure this nation is not only the healthiest nation, but competitive economically.
I wouldn't trade my years at Indiana University for all the gold in California. Had it to do over again, I'd be right back at Hyper, I'd be right back at the School of Public Health at Indiana University.
I had a wonderful experience at Indiana University. It is the most beautiful campus in the world and has so many different resources that you can access, a willing faculty, an exciting student body. I mean, how can you go wrong? It's a fabulous place.
For more information about how you can support the School of Public Health-Bloomington, or information about its many educational offerings and programs, please contact the School of Public Health-Bloomington Office of Development and Communications, SPHB, Room 179, 1025 East 7th Street, Bloomington, 812-855-4712, or sphodc@indiana.edu, or visit our website at publichealth.indiana.edu.